Okay, good morning. Uh, Hope I am audible.
Yes, sir.
Okay. So today we will discuss about another important topic, which is the most common clinical topic that every pediatrician will face in day-to-day clinical practice. That is about loss of appetite. Okay. So most common complaint of the mother is, Doctor, my kid is not interested in food at all. Now, how to tackle this particular problem? This is very important. And so we will see one by one what exactly this is. Now, if you look into the basics of this particular problem, appetite is a desire to eat the food which is also felt as hunger. So एक जो है hunger है, एक appetite है. So what is the difference? Hunger is actually the appetite is the desire to take the food, and the same has been appreciated as hunger. इसी को हम भूख बोलते हैं और हंगर बोलते हैं. ठीक है. एपेटाइट इज खाने का इच्छा. ओके. नाउ द रेगुलेट actually this appetite will go into regulate the adequate energy intake to maintain the metabolic needs. Okay. So this appetite is very important. Okay. Agni, whatever we say Agni, so that is very important to regulate the adequate energy intake to maintain the metabolic needs. That we know. It means if you take some amount of the food that has been utilized for the purpose of metabolism, and that will be utilized for the purpose of production of the ATP and all. Now, eating is the most difficult job. Although we say eating is very easy, but actually talking physiologically, eating is the most difficult job because it involves the maximum organ and systems of the body. So when you are eating, so there is muscular system involvement, there is neurological system involvement, there is sensory system involvement, there is involvement of the respiratory tract, there is involvement of the GIT, okay, there is involvement of the sympathetic and parasympathetic nerves system. So actually eating is a very difficult job because it involves the maximum system. Okay, so now what are the reasons now? Fact and fallacy. Fact and fallacy. First, find out that whenever the mother comes to you with a complaint that my child is not eating well, or मेरा बच्चा खा ही नहीं रहा है, कुछ भी नहीं खाता है, दिन में आधा रोटी भी नहीं खाता है. So whenever mother comes with such complaints to you, then you have to identify whether it's a fact or it's a fallacy. मतलब ये सच है झूठ है, ये real है unreal है, that you have to identify. Okay. So find out first that whether the mother's complaints are true or false. Now ask about the diet history. So what is important in this case is you have to ask about the diet history. Then the mother will tell everything and she will not count the snacks. That means जब आप यूजुअली क्या होता है कि जब आप डाइट हिस्ट्री पूछते हैं मदर से, सो मदर सब बोलता है कि सुबह दूध पीता है, सुबह रोटी खाता है, दोपहर को he will take the chapati, in the lunch he will take some of the rice, and in the dinner again he will take rice and chapati. So she will tell everything, but most of the time what mother misses is she will never count the snacks that she is giving in between. वो snacks को count नहीं कर रही है. So she is giving good amount of the snacks in between, or child himself is eating some of the snacks. Okay, that has been not counted in the routine dietary chart. So this is one of the big mistake that we are doing, or mother is doing. Then if you ask about the defecation and urination of the child, suppose when the mother is telling that मेरा बच्चा कुछ भी नहीं कर रहा है, तो उसके बाद then simply ask whether how many times child is passing the stool and passing the urine. Then mother says वो तो normal है, that is normal. Okay, so now when mother comes with such type of presentation, so that suggests that actually it is a mother who is highlighting these symptoms. Actually child is not having this particular problem. Usually such problems are called as proxy syndromes. Mother is proxying that particular symptom in the child. Otherwise child is normal, child is growing well, child height and weight is normal, passing urine and stool normal, but still mother is telling that my child is not eating. Then you simply ask one question, simple question: how many times a child is passing urine and stool? And if the mother says it is normal, then definitely it is going towards proxy syndrome. Proxy syndrome means it is not actually, the symptom is not present in the child. Forcefully mother or the caregiver is telling, or forcefully she is preparing, or she is highlighting what some of the symptoms forcefully and unnecessarily. Okay, so it may be because of overconsciousness, it may be because of anxiety, mother's own anxiety, or it may be because of the previous other experiences, whatever may be there. But this child is not having such problem, but still mother says that yes, he is not eating well, not eating well, not eating well. Similarly, some other types of proxy syndromes are also there. Many times mother says that he is not at all reading, not at all reading, not at all reading. Child is reading well, but still mother says that he is not reading. Child is reading and also remembering, but mother is again telling she is not remembering, he is not remembering, like this. These are actually some of the examples of proxy syndrome. Anyway, if you insist for suppose if it is a fallacy, it is not the fact, it is unreal, and if you insist for some of the investigation, suppose अच्छा आपका बच्चे को कितना 2 महीने से खाना नहीं खा रहा ना, चलो कुछ इन्वेस्टिगेशन करेंगे और कुछ इसको हॉस्पिटलाइजेशन करेंगे, then usually mother will get back. They try to avoid it. So if such findings are there, such situations you are facing, so you have to think that this is not the fact, this is a fallacy, and probably this is an example of proxy syndrome, where actually the child is not having any problem, but mother is forcefully applicating some of the problems in the child. Now, one of the most common cause why child is not eating, or most of the kids they will not eat, is heavy snacking and junk food. This is one of the most common cause. Okay, heavy snacking, or snacking should be very minimum. Snack food which is given in between the main meal, so that should be very minimum. Okay, but most of the time our snacks will be heavier than the actual meal, and that is the main problem. Okay, so this is one of the cause why children are not eating properly in time. Okay, so when you do not maintain a diet timings or meal time, and irregularly you are giving the meal, and junk food and snackings are very heavy in between, or you are giving some of the snacks during the time of the meal hours or lunch hours, etc. So then they are the most common cause why usually child will not prefer to take the homemade food. Okay. Now many children will consume excess of the junk food and the snack during the normal meal time or just before it. This is a very important cause. ठीक है, अभी 8 बजे खाना है, रूटीन जो हमारा लंच है डिनर है रात का, बट आप 7:30 को जो है एक हैवी स्नैक ले लिया बच्चों ने. ठीक है, कारण कुछ भी हो सकता है. ठीक है, हैवी, और जस्ट बिफोर इट और ड्यूरिंग द मील टाइम, 8 बजे खाना खाना था, उसी टाइम पे जंक फूड ले लिया या कुछ और स्नैक्स ले लिया, या जस्ट 10-15 मिनट पहले ले लिया. सो देन यूजुअली द रूटीन विल बी डिस्टर्ब्ड, and how can a child will come with a normal appetite? Okay, so this will subside the hunger, or the cycle of food intake is disturbed. This is very important. So most of the time when mother comes with this complaint, and if you ask the history very thoroughly, the routine history, diet history and all, so you will come out with this particular problem. You will come out with this particular problem. Now, if you look into some of the other causes, which is most commonly where the child is not eating, that is carbonated drinks. Now this is one more important thing. Okay, excess consumption of the carbonated drinks, जो भी है cold drinks वगैरह जो भी मिलता है, okay, excess consumption, that also leads to fullness of the stomach, and it also subsides the hunger. Then monotonous menu, that is also very important. मोनोटोनस मेन्यू में डेली जो है आप बच्चे को एक ही टाइप का खाना दे रहे हो. ठीक है, मेन्यू में कोई चेंज नहीं है, मोनोटोनस है. ठीक है, चपाती और सब्जी यही चल रहा है, रोटी सब्जी यही चल रहा है, राइस दाल यही चल रहा है. ठीक है, सो डेली यू आर गोइंग विद द सेम मेन्यू, डेफिनेटली चाइल्ड विल बी बोर्ड एंड चाइल्ड मे नॉट take the food, and it may refuse to take the food. So you have to change the menu daily, and also you have to change the taste daily. Okay, so that is also very important. Now some of the problems are there related to the food pads and also other issues. Okay, food pads system जो है, so whether a whole family is sitting together and taking the food, and what is the way of serving, and what is the timings of food intake. So these things are also very important. Sometimes picky eater, child is a picky eater, हर आधा घंटे में कुछ ना कुछ खाता रहता है. ओके, हर आधा घंटे में कुछ ना कुछ खाता रहता है. सो ये सब मदर काउंट नहीं करती है. ठीक है, मदर तो वही काउंट करती है जो मेन मील है, कि सुबह का नाश्ता नहीं खाया, दोपहर का खाना नहीं खाया, रात का खाना नहीं खाया. सो यही काउंट करती है. ठीक है. सो समटाइम ए पिकी ईटर चाइल्ड हर आधा घंटे में जाके कुछ ना कुछ वो डब्बे से निकाल के खाता रहता है. सो और दुकान में जाके कुछ लेके खाता रहता है. सो देन दिस इज वन ऑफ द picky eater. Okay, then reluctant to try something new. Sometime what happens, few kids are there and few parents are also there, so they are not trying something new. वो जो रूटीन है, जो उसको करने में जो आसान है, उसी को वो करते रहते हैं. ठीक है, तो वो बच्चों को बोर हो जाता है. और कभी कभी बच्चे जो है नया चीज़ किए तो उसको लेने का मूड में नहीं रहता है. समटाइम द पेरेंट्स आर नॉट इन ए मूड टू प्रिपेयर द न्यूअर फूड आइटम्स एंड सम द किड इज नॉट इन ए पोजिशन टू टेक द न्यू टेस्ट ऑफ द फूड. Okay, see, he is habituated to the same taste of the food and he is reluctant to new taste of the food. So both the issues are there. Now, unpleasant meal, that is one more important thing. Unpleasant meal, that means taking a negative, unpleasant meal means talking negative things during the meal time. Okay, or scolding or commenting on her study etc. during the meal. So see, this is quite interesting. This is one of the most common cause why the children are not taking food, because usually the food will be taken as a family together. Father, mother, everybody sit together and child is also sitting together and then we will have a meal, isn't it? Usually. Now this system is changing. That's a different issue. Now usually when you make this meal time unpleasant means you use this opportunity to scold the child. बच्चे बाकी टाइम में तो आपको मिलता नहीं है, खाना खाते वक्त आपको मिलता है. So you used to scold the child during the meal time, or you used to ask about the study matter during the meal time. Okay, or if you are commenting on something on him during the meal time, then also this is a negative talking as far as the child is concerned, and child may try to avoid this. मुझे भूख नहीं है बोल के वो उठ के चला जाएगा. Okay, so making the meal time pleasant is also important. You talk something in general during the meal time, not specific to a particular kid. ठीक है, आज क्लास में क्या हुआ, टीचर ने क्या बोला, होमवर्क क्या दिया. अब ये सब चीज़ें जो है, if you are asking during the meal time, definitely the child will going to skip the meal. Okay, so then sometime depression or school related issues and sibling related issues. ठीक है, स्कूल में कोई झगड़ा हुआ है फ्रेंड्स के साथ और फ्रेंडशिप नहीं करते हैं, कोई टीजिंग हुआ है. सो लाइक दिस समटाइम डिप्रेशन, मार्क्स नहीं आया ठीक से, सो एग्जामिनेशन टेंशन. सो ऑल दीज थिंग्स में ऑल्सो लीड्स टू लॉस ऑफ एपेटाइट इन द चिल्ड्रन. सो व्हेन पेरेंट्स आर कमिंग विद दिस कंप्लेंट, first you conclude, that means diagnose that it is not a proxy syndrome. So once it is clear that it is not a proxy syndrome, so then you discuss about all these issues. Now again, what could be the core issue now? Now the improper weaning technique may be one of the cause why the child is developing this loss of appetite. Okay, so you have not done the weaning or complementary food feeding. The transition is not done very smoothly, and that may be one of the issue in the infants or toddlers, etc. Okay, and another in the infant and toddlers, there is a loss of appetite, that is a use of pacifiers. So instead of breastfeeding, you are giving some of the rubber nipples, etc. Then sometimes pharyngitis, child is suffering from pharyngitis. Then child may have this particular problem. Then evolving hepatitis, sometime there is some viral infection is upcoming. Okay, so that time also child may have loss of appetite. Then as a constitutional symptom in certain chronic disorders, we know that appetite is coming as a constitutional symptom, especially in tuberculosis or some other chronic disorders. Okay, loss of weight, loss of growth velocity is flattened. Along with that, child is also having loss of appetite. So that is a serious issue. Okay, then sometime the loss of appetite is also there in the worm infestation. Okay, so worm infestation, so that is one of the important issue. So you have to ask about that also. Then very important is anemia. Okay, you know, many times anemia is one of the most common cause of loss of appetite. Okay, anemia and pica eating, non-nutritious food. Anemia, because of anemia, actually the whole body metabolism comes down, and then loss of concentration, irritability. Okay, then easy fatigability. So all these things leads to loss of appetite. Then some of the gastrointestinal reflux disorders may also lead to esophagitis or some reflux esophagitis, etc. conditions. It may also lead to loss of appetite. Then congestive cardiac failure. These are some of the bigger issues. Congestive cardiac failure, renal disorders, chronic renal disorders may also lead to loss of appetite. These are the serious pathological conditions, most of them. But first we have to exclude the common things. Some of the other issues may be like palatopharyngeal incoordination. A patient, child suffering from HIE, so may suffer with this palatopharyngeal incoordination, that because of pharyngeal muscles and palatal muscles, so they are supplied by the nerves, especially from the midbrain. We know that pseudo bulbar palsy and all those things. So when there is no proper coordination, incoordination is there, the child is not able to engulf the food, and that may lead to loss of appetite. Autism spectrum disorders, yes, this is other set of disorders where, like autism spectrum disorders, there also child may have couplets of appetite, because child is not at all having any sensory perceptions. Okay, he is not able to appreciate the smell, he is not able to appreciate the taste. So for him, every food is simply same. Okay, so monotonous. So whatever food you give, different taste also, it is monotonous to him. Okay, because a sensory block is there in case of autism. Then hypothyroidism, yes, hypothyroidism, T3, T4 is less, basal metabolic rate falls, and that may also lead to loss of appetite. Any long-standing foreign body in the upper GIT, that may also lead to loss of appetite, because it irritates him. Whenever he takes the food, it touches there and leads to pain. So child may develop loss of appetite. Chronic kidney disease. Okay, because again, acidosis, alkalosis, renal tubular acidosis, etc. will going to occur in case of chronic kidney disorders. That indirectly affects. Tuberculosis, yes, loss of appetite is one of the very important constitutional symptoms. Okay, then malignancy, yes, in the malignancy also, we know that loss of appetite, loss of weight, these are all the constitutional symptoms which occurs in malignancy also, chronic disorders also. So that we have to understand. Now if we look into some of the rare organic causes of loss of appetite, very rare organic causes which can be seen sometimes. For example, one of the condition which is many patients also came in our OPD, that is Russell-Silver syndrome or Silver-Russell syndrome. You know that this is one of the condition where short baby will be there, short active baby will be there. We know that. Okay, poor appetite is seen in case of Silver-Russell syndrome. Okay, fizziness, then triangular face. We know that Silver-Russell syndrome, there is a triangular face with a slow feeding and other problems related to oromotor feedings. Usually, child with the Silver-Russell syndrome will have loss of appetite and some of the feeding difficulties. Another problem is Noonan syndrome, just opposite to the Turner syndrome. Noonan syndrome, there also child usually complains of loss of appetite. The problem why it is happening is usually in Noonan syndrome, child is a slow eater. Why he is a slow eater? Because in case of Noonan syndrome, the motility of the foregut is very less. Foregut motility is less. So whatever he is eating, it is not cleared from the stomach so fastly or in time. So it is collected there only, and therefore child is not having the appetite. Then sometimes duodenal web-like conditions. Duodenal web which can be diagnosed by USG or barium meal studies, etc. So in case of duodenal web also, food is collected there only and child is having loss of appetite. Then congenital myopathies. Okay, in some of the congenital myopathies related to the oropharyngeal cavity, okay, maybe the oral cavity, pharyngeal muscles, etc. It may also present with the feeding difficulties affecting the safety of the swallowing and present early in the infancy usually, and this requires a multidisciplinary treatment. Anyhow, different types of myopathies. Okay, जैसा हम जो DMD वगैरह देखे हैं, मस्कुलर डिस्ट्रोफी में हमने बताया कि 10 टाइप का प्रेजेंटेशन होता है उसमें मस्कुलर वीकनेस का, है ना, कि अपर मसल, फेस मसल मायोपैथी, ओरोफेरेंजियल मसल, eye muscles. So like that, if there is myopathy involving the oropharyngeal muscles, so then there may be problem related to deglutition, and also child is presented with the loss of appetite. Now this is given as a DSM-4 criteria, feeding disorders in infancy and early childhood, DSM-4 criteria, diagnostic criteria. Okay, So this is given DSM criteria. When you say that child is having loss of appetite, persistent failure to eat adequately with significant weight loss for at least 1 month. ठीक है, अगर बच्चा जो है persistent failure to eat, significantly weight loss भी हो रहा है at least for 1 month, that is one criteria. Second is not due to primary GAT problems. If the loss of appetite is not because of any of the primary GAT problems or other general medical conditions like gastroesophageal reflux disease, etc., so then it has to be taken. Then not accounted for by another developmental disorders, example rumination disorder, etc. बाकी कोई भी disorder associated नहीं है, like autism, maybe rumination disorders, etc. And if the onset is before the age of 6 years, okay, so then we will consider it as feeding disorders in infancy and early childhood. And these are the 4 important criteria for the diagnosis of feeding disorders in infancy and early childhood. ठीक है, ये 4 criteria. Onset is before the age of 6 years. There is no other disorders like rumination disorders or autism disorders, etc. It is not primarily because of any of the GAT problems or some other general medicinal conditions like GERD, etc. And what is that? Persistent failure to eat adequately with a significant weight loss at least for 1 month. Then only it is considered as feeding disorders in infancy and childhood. Is not eating, that means child is not eating. Sometimes it may be a fallacy, as I told in case of Proxy syndrome and all. Exact age of birth weight, exact age, go for the growth chart and IAP. That means when the child, whenever the mother comes to you and tell that with the complaints that my child is not eating, first you have to look into the growth chart. Okay, height, weight, you see whether it matches with the mother's complaint or not. And if whatever mother is telling, but growth chart is normal, then it is a fallacy. Okay, if such plotting is done periodically and there is a flattering, then there is a need to concern. That means if there is no flattering, that means आप ग्रोथ चार्ट को मेंटेन कर रहे हो, उसमें कोई फ्लैटरिंग नहीं है, वो सब नहीं है, तो कोई वरी बात नहीं है. अगर ग्रोथ चार्ट आप मेंटेन कर रहे हो और इफ द ग्रोथ चार्ट इज फ्लैटरिंग, then you have to identify some of the disease at the earliest. There is some problem, maybe hypothyroidism, maybe some other problems. Okay, as I told, sometimes it may be also because of the Proxy syndrome. So these are some of the important issues. So next part we will continue in the next class. Thank you very much.